My name is Erica Figueroa. I am a research project manager at the Center for Public Partnership and Research, and I will be facilitating our monthly webinar today. I am joined by my colleague, Julia. She will be making sure that the links are added into the chat. If you have a technical difficulty during the actual webinar itself, please feel free to reach out to her. And when we get to our main presentation, I will also introduce my other colleague, Chris Tilden, who will be doing our presentation today. So first thing is just a couple of reminders. Our monthly webinar schedule did change. So this is our September 20th one. Our next one is on October 18th. You can also sign up to receive our newsletters that will give any updates that we have about the webinars themselves, and also lots of wonderful information. Today, like I said, we are going to be joined by my colleague, Chris Tilden. He is going to be presenting on the current statewide Kansas Early Childhood Needs Assessment. And then following that, we will be doing early childhood systems updates like we always do towards the end of the presentation. And with that, I will let Chris take it away.
Thank you, Erica, and thank you all for joining the webinar today. For a couple of months, we have been working on a new early childhood needs assessment for the state of Kansas, and I was asked to put together a short presentation. I hope this is very informal as I go through the slides. If you have questions, observations, certainly do not feel like you need to wait to the end of the presentation to provide feedback. I've got a relatively short set of slides that will show both. We'll talk a little bit about the process as well as some initial findings from the needs assessment, and would love any feedback you all would like to share. Go ahead and we can get started. As a way of background, I assume most of you, having followed this process for a couple of years, recognize that a lot of our work in recent years has been facilitated and supported by a number of grants, certainly one of those being the PDG Birth Through 5 grant awarded to the Kansas Children's Cabinet and Trust Fund. And we were fortunate enough early in 2023 to receive a new one-year planning grant. And so the development of this needs assessment is supported by that grant. We certainly recognize that there has been a lot of important work done. The first PDG planning grant in 2019 was used to develop our first statewide early childhood needs assessment. I would encourage those of you, if you have not seen that document, to go back and take a look at the original report. And subsequently, we have done annual updates. So this very much will build on the work that's been done over the last few years. I think it's also important to recognize that this isn't a plan that I envision will sit on the shelf. And one of the important things about this plan is that it will be used to inform the development of a new early childhood system strategic plan. Out of the 2019 needs assessment process, we developed a statewide strategic plan, which I think has been instrumental in guiding activity over the last 3 years. But we certainly recognize that we have covered a lot of ground in those 3 or 4 years with a pandemic and a lot of other changes in our state that we recognize provide us an opportunity to take pause and think about the goals that were developed as part of that plan and to decide if we need to think about modifying our direction as we move forward. So this assessment will inform the development of a new strategic plan, a planning process that will likely begin later this year and continue on into 2024. Next slide. I wanted to talk a little bit in terms of our approach. I think one of the things that you all probably will recognize is that back in 2019, there was a whole series of various surveys, listening sessions around the state. We had input from over 6,000 Kansans, and it was very explicitly focused around the development of the needs assessment. You all will probably recognize that we haven't taken that approach this time around. We felt given all that's transpired, given all the work being done, there's an awful lot of information that is available at our fingertips that we've been able to utilize in developing this needs assessment. So one of those, if you look, there have been a plethora of recently produced evaluation and needs assessment reports that we have been able to use to inform this work. Through pandemic funding to many of the state agencies, there have been reports reflecting on the utilization of those funds and the degree to which funding decisions were informed by the goals in the Early Childhood Strategic Plan. A number of programs have produced needs assessment documents in the wake of the pandemic, looking at how their programs have responded to the pandemic and how they have subsequently rebounded after as the pandemic has come to an end. There have been a number of reports focused on work at a statewide level that we'll talk about as we move through the presentation. There have also been an array of opportunities to gather perspective from individuals and organizations that are part of the early childhood system and that have been impacted by the system. A couple of examples that I've included in the slides here. Late last fall, there was a developmental health survey administered around the state. We had over 1,500 parents and providers respond to that survey. That was followed by a series of engagement sessions this spring that involved hundreds of people from around the state, both parents and providers. There were sessions in both English and Spanish, and a lot of good dialogue and ideas for ways to enhance the work we're doing to promote the development and health of children were gathered through that process. Many of you have been part of the discussions around the development of the career pathway that's been led by Casito in collaboration with the Workforce Development Advisory Group. They have been facilitating a number of engagement sessions to inform the development of and implementation of the career pathway. As part of this process, we've worked with Child Care Aware to actually have discussions with childcare operators who closed as a result of the pandemic. And in some cases, some of those operators have been able to reopen, and some remain closed as of our discussion today. And we felt it was important to understand those dynamics. What were the key elements that went into decisions to close? Were there important resources, changes in policy, changes in conditions across the state that enabled some of them to reopen? We felt like that perspective was really valuable. I mentioned that we did a series of listening tours associated with the 2019 needs assessment. And while we did not specifically design and carry out a group of listening tours around early childhood issues. We were fortunate enough that the Early Childhood Transition Task Force that was assembled by the governor's office early this year did have a series of listening events around the state in recent months that many of you, I'm sure, participated in that process, as did many providers, parents, and other constituents who are interested in early childhood issues. There have been several reports that have come out of those listening sessions that were really vital in helping inform our work. And we've continued to do things like collect stories through Our Tomorrow's Early Childhood Story Bank. So I think we've despite the fact that we took a different approach, I think there was a wealth of information at our disposal to synthesize both what we were hearing through discussion around the state, data that's been collected through various reports and needs assessment documents to put together a meaningful needs assessment that examines where we are in 2023. Next slide. I do think it's important to note that we utilized the principal goals in the All In for Kansas Kids strategic plan to inform our work, which is not to say, again, that there may be, thought about how we structure our goals going this as we develop the next version of the strategic plan. But we wanted to recognize that currently the strategic plan is focused around 5 key issues. And one of those has been promoting coordination and collaboration. And that is both at a local level as well as at the state level, and working to ensure for robust collaboration between the public and private sector. Another area of focus, another goal, was to ensure that we're promoting and enhancing knowledge and choice among parents and families who are impacted by the system. Another area, a goal, was enhancing and supporting workforce. The other 2 being work to promote quality in environments. And lastly, obviously, to ensure that we're building capacity and access. Next slide. I think it's also important to note that our work has also been guided by the key findings of previous needs assessments. And again, this is not to say that there will not be additional issues and concerns that we uncover in this process. But there were 3 key findings in the previous needs assessment documents, and we felt it was important to ask questions or to be thinking about these questions as we were gathering the information for this needs assessment. Those findings included: 1, the observation that we recognize that there are financial and geographic disparities in access and availability of early childhood services around the state. And so we wanted to ask the question, in 2023, are we still observing, are we still experiencing financial and geographic disparities? In 2019, one of the findings was that many Kansas families were struggling with access to affordable childcare. And lastly, we recognize that the early childhood workforce, has been and continues to be stressed, in large part due to the fact that we're really operating under a business model that's problematic, in the sense that families can't afford access to care. But at the same point in time, providers are not able to afford to pay adequate wages to enable their staff to be able to buy the things that they need. And in some cases, providers simply don't have the resources to even keep the doors open. So we wanted to ask questions. Where are we in terms of these important findings that were identified back in 2019, and that in subsequent updates we recognized were still issues? Next slide. So I'm kind of going to go through goal by goal. from the framework for the strategic plan and talk a little bit about findings, both in terms of where we have seen some great progress, but also in terms of areas where there still may be gaps or where there may be barriers. So in terms of the goal around coordination, I think we would all recognize that collectively, looking at the state director's team and all of the various work groups and committees that are part of the recognized early childhood governance structure for the state, there have been an awful lot of initiatives that have improved and enhanced coordination. There's been significant coordination to build capacity around 1-800-Children. The agencies that are part of the early childhood state directors team, as well as the Department of Corrections, came together to establish a data trust to look at ways to ensure that we are able to use data across agencies to inform decisions. And that's been really significant work. There was the development of a common app, which has been utilized by many agencies for various grant initiatives in hopes to streamline that system. I mentioned earlier the work on the career pathway, but also within the context of workforce work, there's been significant development with the workforce registry that we are looking to implement in the state. We also have evidence that there's a lot of growing collaboration at a local level, and there is a lot of evidence, but one of the things that we have done is a network analysis looking at collaboration among the partners that are part of the local interagency coordinating councils, which oversee the Part C, or the early childhood development services programs around the state. And those analyses have shown that the LICC are growing and really enhancing collaboration at the local level. In addition to the statewide work in the state agencies, it's also, I think, important to recognize that there are private partners and other government agencies that have been part of this work. So, private partners like Child Care Aware, Kansas Children's Service League, Kansas Head Start Association, and I know this list is incomplete, agencies like the Department of Commerce, they have all been collaborating with the early childhood governance to advance the system. So I think in the area of collaboration, we've seen an awful lot of progress in recent years. In terms of some areas where we have room for improvement, while we have certainly improved coordination, there are just inherent inefficiencies in the coordinated multi-agency model that we utilize in the state. And unfortunately, when the Bipartisan Policy Center earlier this year came out with a ranking of states in terms of efficiency in their system, we actually ranked next to last in the country in terms of the efficiency of our system. So we know we have a lot of work to do. This was recognized by the governor and other key leaders, and led, I think in part to the development of the executive order, the first of this year of 2023 out of Governor Kelly's office, that established the task force that I'm sure you all are aware of and that I mentioned earlier, that's looking at development of a new governance system and approach for early childhood. Next slide. Around parent information and choice, I have already mentioned 1-800-Children, and if you look at utilization, it has grown significantly in the years that we have been utilizing PDG and other funds to enhance and build that system. So we've certainly seen growing utilization and parents being able to utilize 800-Children as a centralized resource in the state. There have been, through PDG and other programs, efforts to build pilot projects that look at mechanisms to coordinate care so that parents have better information and are better able to access the various services they need for their children. And there have been some wonderful examples here. I highlighted specifically the Bridges program at KDHE, which has been utilized to enhance as children reach the age 3 and graduate out of the Part C or Early Childhood Developmental Services program, ensuring that they are being linked to other resources. That pilot program, which was originally funded with PDG, now has actually been integrated into KDHE's ongoing maternal and child health programming in 4 communities, and they're looking to expand that across the state. So I think that's a great example of some success that has come out of a pilot effort. We've also seen with the development of the statewide ASQ enterprise, a large increase in the number of developmental screens that are happening among our children in the state. So increased emphasis on, and as a result, a real increase in developmental screening, which enables us to ensure that parents have information they need about services that might be useful and important for their children. Next slide. Having talked about success, there are still an awful lot of evidence that suggests that those disparities that I mentioned earlier, disparities based on geography, differences in populations that live in rural and urban areas, access to services in low-income communities, there's still an awful lot of evidence suggesting that those disparities still exist. As we talk to parents about the information they had access to, there still is frustration. As we talk to parents about developmental surveying, they said, our children are getting screened, we do get some information, but we would like more information and to understand how to utilize that for decision making. So I think we're still hearing parents say, I have access to some wonderful resources, but it still feels like I, as a parent, have to connect the dots and really don't have the resources I need to rely on. Also, if you look at utilization rates of some of the key benefit programs that particularly can benefit low-income families, if you look at things like TANF, if you look at things like SNAP, what had been previously known as the food stamps program, Kansas, compared to most states in the country, have really low utilization of those programs, which is evidence that we're still not doing a terribly good job of connecting families to those basic resources that they need to ensure their families are thriving and doing well. In addition to some of the geographic and financial disparities, there's also evidence that we have racial and ethnic disparities in a number of situations. And one of those I point out here in the slides is that one of the things we have done is to assess worksite conditions. Are family-friendly policies uniformly available to families across the state? And when you look at things like access to subsidized childcare, on-site childcare, infant at work policies and programs, and other family resources, evidence suggests that there are racial and ethnic disparities, and that people of color in work sites have less access to those important family-friendly resources. Next slide, please. In terms of workforce, do we have a system that supports a trained and well-compensated and resilient workforce? One promising sign is that during and immediately following the pandemic, we'd seen a decrease in the number of childcare workers operating in our licensed facilities. Those numbers did start to tick up again in 2023 and actually are close to, if not almost surpassing, the pre-pandemic numbers. So in terms of overall numbers of people in the workforce, we do have some good news. Casito conducted a workforce survey earlier this year. And on the whole, majority of providers said that they feel good about their career, about their social and emotional health, and their financial stability. And earlier, as it relates to statewide efforts, I've already made some remarks regarding progress that's been made on the career pathway and workforce registry, both of which we are in the process of implementing as we speak. While I say on the whole, our workforce says they are doing well, there still are a significant number of providers. And in the Casito workforce survey, about a third, 32.4% of providers who said from a financial perspective, they simply they were not well compensated enough to buy the things that they feel they need to support their families. Many programs also report staffing challenges. I mentioned some program needs assessment. The MCH program at KDHE was one that did an interim needs assessment earlier this year. And there was a workforce survey, and approximately half of those MCH providers indicated that they felt their programs were not adequately staffed. So certainly within childcare, but also within other early childhood programs, I think we're still feeling effects of struggle to recruit and retain providers. I provided a comment from one of the discussions that I think summarizes this well, and that was a provider who said it's hard to recruit teachers on what childcare pays, especially with the stress of the pandemic. All right, next slide. In terms of quality environments, I think from this effort, as I said, is supported by PDG, and this isn't all. I mean, we've utilized an awful lot of other funds to support this work in recent years, but in terms of PDG funding alone, over 8.5 million of those funds that we've received over the last 3-4 years have actually been invested in local efforts to ensure that early childhood providers can recruit and retain workforce, that they can appropriately equip their facilities, and in general ensure that there are high quality services available to children and families. So we've been making a significant investment in this work at a local level, at a state level. There have been numerous initiatives, but I wanted to highlight Links to Quality, which has developed an early childhood standard of quality and is working to provide a diverse array of resources that supports efforts for providers to build their skills, develop resources, and build connections to help them ensure quality of care. I guess my first bullet here is kind of the good news, bad news, and that is when we talk about quality services and access to those services, you all are probably aware of the recently announced Child Care Accelerator grants. And the good news is that the state was able to fund over $40 million in requests to support capacity building in the system. At the same time, that 40 million represents about a third of overall funds that are requested. $117 million of funds were requested to support capacity building. And as a state, we're able to support a fraction of that. And not only is it important to talk about resources, but I think important to recognize that there's a gap between the resources that are available and also the awareness of those services around people that are part of our system. The Casita Workforce Survey, for instance, noted that only about 4 of 10, sorry, wrong statistic, only 1 in 4, 39.9%. I said 1 in 4 again, 4 of 10, 39.9% of child care providers are familiar with the Kansas, Missouri core competencies for early childhood. And a smaller percentage still, about 1 in 5, I think I got that right this time, about 1 in 5, 17.8% of providers indicated that they were familiar with links to quality that I mentioned earlier. So we've been doing a lot of work to develop. We're in the midst of, for instance, developing new core competencies, links to quality with their new system. There's still a fair number of providers in the state that are not aware and know of these important resources. Next slide. So at the end of the day, it's important to ask the question, do Kansas families have the access they need? Do they have access to the needed early childhood services that are important for the well-being of their children? And if we look and recognize the impact that the pandemic had, we certainly know that it had a negative impact on access to services. But it certainly is a bright spot that through stabilization funding, which in the state of Kansas total over $300 million, the distribution of that funding was able to ensure that approximately 100,000 Kansas children were able to continue to receive child care services and facilities that were supported by those dollars. And also, for the first time this year in 5 years, in 2023, there actually was an increase in the number of licensed child care programs in the state, which grew from 4,064 in 2022 to 4,144 in 2023. So that report is recently released, and certainly good to see that we're at least on a positive trajectory. Next slide. While I just noted that we have seen an overall increase in the number of licensed facilities, there still is, I think, an area of challenge, and that's particularly in the area of the licensed family child care homes. And these are those smaller home-based facilities that are licensed to care for a maximum of 10 children. Those numbers have not rebounded. In fact, we have seen a consistent decline each year from in 2019, there were close to 2,500 of those licensed homes in the state. That number is now less than 2,000 in 2023 and has again decreased significantly every year. And we still estimate that the demand in every Kansas county for childcare exceeds the capacity that exists in our counties. And we recognize that it's still expensive. It is estimated that childcare costs in Kansas exceed all other household expenses. A median couple in Kansas, infant care in a center-based environment takes about 14% of that couple's income, and a median single parent income literally would need to utilize 45%, almost half of their income, to simply have an infant in center-based care. So we still know that affordability, accessibility is an issue that needs to be addressed. So in summary, I think there are a lot of examples of progress, through the efforts of many, many organizations and individuals, including many of you on this call. We're making a lot of progress. And the needs assessment, I hope, is not going to be just, doom and gloom in terms of here are the barriers and the challenges, which we know exist. But we want to take note of the fact that we recognize that there are significant accomplishments and that we are making significant progress. But at the same time, again, yes, work remains, and the needs assessment, we hope, will be an important document in informing our next strategic plan, which over the next 4 to 5 years will guide efforts to try to continue to enhance the system. Next slide, please. All right. I'd like to pause here. If there are any questions, I'd be happy to try to field those. And would also enjoy some insight, as you listen to the presentation. What have we got right so far? Do the findings that we discussed today, are those consistent with your experiences and knowledge of the system? And is there anything as you listen that you thought you might hear that you think is and that you'd like to ensure that we're talking about and thinking about as we develop the needs assessment? I'm going to take a moment and see if there are questions and or comments.
We'll also be monitoring the chat, so if you want to go ahead and just type your question into the chat as well, you can go ahead and do that.
And I would also just add, as you reflect on this as well, and afterwards, if there are things that you think of that you would like us to integrate into our thought process as we work to finalize a needs assessment, please feel free to reach out to us. Cora asked about the annual dollar amount, and I don't know that I can try, but I don't know that I have that actual documentation in front of me, but we certainly can provide follow-up answers to that question if in the next couple of minutes I can't put my hand on that particular resource. But yeah, that's excellent question.
Pamela said it would be nice to supplement the home/group daycare providers who want to take special need children but can't afford it.
Yeah, thank you for that, Pamela. I don't know that was reflected specifically in the resource here, but I do think one of the things that we noted is that particularly with children with special healthcare needs, that the issue around care coordination is one. I know that the MCH program and the Children with Special Healthcare Needs program has been, the Bridges pilot and others have come out of a recognition, particularly that care coordination with families that have special needs is really challenging, and that in a local community, oftentimes families with children with special healthcare needs have difficulty accessing those services at a local level. So thinking about how we enhance those services for those higher needs children is certainly important, and I think something that definitely is recognized and will be highlighted in this report.
Pamela added, paying for additional support staff to come into the home is so important to have additional support for that child. And then she said that would be wonderful.
Yeah, thank you again for highlighting that, because it's something that I think it is also not unique to Kansas, as in the work that we do in other states, we also recognize that disparities in outcomes for children with special health care needs is something that that is a real challenge across the country, and something we need to recognize and address in the work that we do. So, thanks for your comments.
Michelle commented, for children on child care assistance, there is an opportunity for an enhanced rate of 7.25 per hour for children with higher needs that require more intense care.
As always, I'm glad Nikki is on the call because she is a wealth of content, knowledge, and expertise around assistance, and it's certainly important to recognize the resources that are available.
Yep, and Pamela just added, not all that need additional care are getting assistance, and that's the concern. So sounds like bringing up the topic of making sure the awareness that assistance is available is one of the things that they're discussing. Jeanette Turbin said, is that through DCF?
Yeah, Nikki's well, I was going to say, Nikki has responded that yes, that additional hourly support is through the child care assistance program at Children and Families. Nikki also noted that income levels are 250% of the federal poverty level, and that's a increase cap that was increased during the pandemic, and as I understand it, will continue post-pandemic. So certainly there's an opportunity for more families to access that through that new higher eligibility criteria. Super resource.
Chris Cora also asked, she said she may have missed it, but it was looked at to see if the need for infant care versus the number of spots available.
Yeah, I'd have to go back, but I believe that is documented in the new supply demand report from Child Care Aware. But I'll also make a note to look at those numbers. And Cora, I know you had several questions that I haven't addressed specifically and directly, so I'll make sure that we do that after the fact and can share them back with the group as well.
Jeanette asked, have the requirements of the subsidy changed such that people who have changing schedules like shift work, like wait staff, retail, can still get access even though their care needs fluctuate based on how they are scheduled? Historically, that had been a large barrier that I have seen.
Given that we have Nikki on the call, Nikki, I don't know if you want to come off. She responded in the chat box and said, yes, that time worked is averaged. All right, well, with comments slowing down a bit, why don't we just quickly go to the next slide, which is not to say if you have questions or comments, feel free to continue to use the chat and or come off mute. But want to point out that we're still in the process of developing the assessment. I think at this point There's the possibility for additional reports and information that could be integrated, but for the most part, I think we've completed our data collection and synthesis exercise. So at this point in time, we're going to continue when we have an opportunity to have these kinds of presentations and discussions to hear from people around the state and gather feedback and use that feedback and discussion to refine the document. Our ultimate goal being to present to the Children's Cabinet a needs assessment for endorsement at their December 1 meeting, which will, as we noted, be followed by discussion about the development of the strategic plan, for which some discussions have begun, but will be certainly informed by these efforts. And I think that's it slide-wise. Again, I think we have a few minutes, so if there are any additional comments, questions, I certainly don't want to make sure everyone has an opportunity. Well, I want to thank all of you for, one, participating in this webinar, for your ongoing, participation in these statewide discussions to build a strong early childhood system, and for your day-to-day work to build the system. I mean, this is a collaborative effort. As I said, a key goal in the state plan was to build collaboration, and I think that's certainly one of the bright spots in recent years has been the can-do attitude that all of the constituents, all of the people who are involved in this effort have really stepped forward to ensure that we're doing what we can to build an early childhood system. You all are an important voice and important part of that process, and it's I really appreciate the opportunity to be part of this work and to watch the advancements that you all are making happen around the state. So thanks again.
Thank you so much, Chris, for that. And we will go next into our updates, as we always do. The National Association for Child Care Accreditation, CASITO, is working to help provide scholarships for that accreditation. You would be able to earn the accreditation that's valued at $1,000 for free. And so this is for childcare providers and small business owners. I believe it's family childcare providers. Spots are limited, so please feel free to, Julia has popped the link in the chat, so feel free to follow that link to learn more, and also apply for that opportunity to get a National Association for Family Child Care accreditation. The next portion is the Capital Projects Accelerators Fund. I'm sure you all have heard about this previously. But the Capital Projects Fund will award $38 million in construction-only grants to expand on the state's efforts to create new licensed child care slots, while adding space to enable work, health monitoring, and education supports. So these are kind of I would say attuned more to community center constructions. So places that can serve not only as childcare, but also as places for work support, health monitoring, and those educations. The RFP is out, and technical assistance is available. The first round of RFP is due October 2nd. And then the second round is December 18th. If you want to learn more about that, please follow the website that was put into the chat. Upcoming conferences, the National Prenatal to 3 Research Policy Summit is going to be October 12th. That summit is free and virtual, so you are able to join. Always have very in-depth conversations and really wonderful knowledge. The 47th Annual Governors Conference for the Prevention of Child Abuse and Neglect is also happening from October 18th to October 20th in Wichita. It is an in-person conference, so please follow the link that's in the chat to find out more. And then lastly, we have the NAIAC annual conference. You can attend in person, is going to be in Nashville, Tennessee. And that is November 15th through 18th. And Julia went ahead and put the information to find out more about that in the chat. Some general updates. So an update on Kansas home visiting. Encompassing a variety of volunteer programs that brings trained family support professionals to homes of pregnant women and families that have young children. Many of you are, I'm sure, familiar with home visiting or even part of home visiting programs yourself. All services are provided at no cost to families and can support pregnancy all the way up until the child turns 5. We have some updated numbers in this update. So what they're updating is for that last year has served 14,319 children and 11,647 families. So to find out more about that report and more of the general updates, you can follow the link for Kansas Home Visiting, Connecting Parents to Support. And then finally, for some professional development, Kansas's Teachers Association, or CAPATA, is holding a Loving Literacy Home Visits virtual training on September 21st. Incorporates songs, finger plays, routines, transitions, book sharing, and engagement. So the registration link is in the chat for that. And then highlighting the work that Greenbush is doing for their professional development, offering both a variety of in-person and virtual trainings and workshops, and find out more about Greenbush itself at their website and also what they are providing on the events calendar. So those are the early childhood updates, just as a reminder for next events coming up. The next Children's Cabinet meeting is October 6th on Friday. That's from 9 a.m. to 12 p.m. The next Early Childhood Systems Building webinar. So the next iteration of this webinar is October 18th from 12 p.m. to 1 p.m. And then the next Early Childhood Recommendations panel meeting is October 20th from 9 a.m. to 11:30 p.m. And all of those meetings can be viewed on YouTube at the Children's Cabinet's YouTube channel. And that is it for us today. Please stay up to date with all of our social media. And if you do have any questions that you thought of as we were going through the updates, please feel free to add them into the chat, and we will make sure that Chris gets them. Or if they have something to do with the general updates, Julia and I will make sure to get that response to you. Thank you all for coming.